Hi friends, in this video we shall discuss about the rehabilitation of low back pain to strengthen mainly the lower lumbar area which is more prone to degenerative conditions. We shall advise mainly extension exercise. The basic principle regarding rehabilitation is individualized advice. That means if a patient who is continuously sitting, that patient should be advised with more extension exercise than flexion exercise. While a patient who is continuously standing, in that patient, flexion and extension exercise shall be incorporated equally. Coming to the most common rehabilitation of lower lumbar spine, it includes mainly this exercise is called pelvic lift. Also, it is called as bridge. In this particular exercise, ask the patient to flex the knee up to 90 degree. The patient is in supine position and ask the patient to breathe in and lift the pelvis up. Hold that position for a while and then come back to normal position with exhalation. This is called as pelvic lift or bridge, and this is a yoga posture called Sedu Bandhanasana. Coming to next rehabilitation, this right-sided picture is a yoga posture called Pavana Muktasana. This is actually a flexion exercise, and this particular position is knee chest posture, which is half of Pavana Muktasana, just flexion of hip only. It shall be done with breathing. This Pavana Muktasana, the breathing should be in 4 steps. While coming to knee chest posture, it is needed only up to 2 steps. This is Pavana Muktasana, and half of Pavana Muktasana is knee chest posture. Actually, it is a flexion exercise. Mainly, it gives strength to the sacroiliac ligaments. Coming to next one, this is Salabhasana, in which extension of hip is done, and actually this is an extension exercise which shall also be incorporated in a modified way by lifting the extension of left hip and elevation of right arm like this. It shall be done like this, and then on the counterpart, extension of right hip with elevation of left arm. It shall be done. This is a very good extension exercise for strengthening the lumbar area, lumbar spine. And this is lower trunk rotation. And in this lower trunk rotation, what we are doing is flexion of knee up to 90 degree and then moving the knee touching the ground to both opposite sides in a semicircular way. This is lower trunk rotation, which is a very good exercise. Coming to Bhujangasana or Cobra Posture, actually this is an extension exercise in which we are raising the head up to complete spine. This is extension exercise which is very effective. It shall be done in controlled way without causing pain. And with inhalation, the patient should rise up, and with exhalation, come to normal position. This is Cobra Posture or Bhujangasana. And this exercise is actually isometric exercise in which shall be incorporated in the initial phase itself, in which the patient's knee is flexed up to 90 degree and both the arm should be held tightly and kept above the head, and ask the patient to press the lumbar spine down to the ground, hold it for 5 seconds and repeat it for 10 times. Coming to the conclusion of rehabilitation, this is first one, pelvic lift. Then this one is knee chest posture. This one is SLR, straight leg raising or Meru Dandasana, in which one knee is flexed up to 90 degree and another leg which is kept straight should be raised in normal position as straight leg raise. Hold it for a while and then come to normal position and repeat it for 10 times and then repeat it for the other leg. This is Cobra Posture or Bhujangasana, and in this is an isometric exercise in which the lumbar spine is pressed towards the ground and hold it for a while. The main thing to be noted is in common all pathological condition and disc prolapse, extension exercise is very effective, while in spondylolisthesis and in spinal canal stenosis with apicanal diameter below 10 mm, in such conditions, extension exercise shall be avoided. Please note, in listhesis and also in spinal canal stenosis, extension exercise shall be avoided. In all other conditions, extension exercise is very much effective than flexion exercise in other pathologies. This lumbar rehabilitation is of utmost importance to avoid the recurrence of lumbar disease, and the rehabilitation get lot of benefits to avoid recurrence and to strengthen the spine and to maintain the quality of life of that particular patient, so that we shall incorporate rehabilitation after the pain relief. That's very important. After Amapajana, rehabilitation should be advised. If we advise rehabilitation before Amapajana, then it causes aggravation of symptoms, so that after the inflammatory stage, rehabilitation shall be incorporated. It's of utmost importance, and we shall include rehabilitation to avoid recurrence and for the better quality of life of the patient, to get rid of the disease very fast. Thank you.